everyone. Thank you for coming today. My name is Lucas Ryberg. I'm a co-founder of Phas3. I'm here with my co-founders Dan Ebeling and Sean Doherty back here. So we started Phas3 as a part of MedLaunch, which is a SLU organization. In 2017, we've been working on it full-time ever since. So this is Bob. Bob is just getting discharged from the hospital after having a heart attack. His doctor is telling him he's going to be prescribed cardiac rehabilitation, which is a specialized rehab program with the goal of helping Bob recover from the incident. The doctor encourages Bob to go to this rehab program because decades worth of data shows that participants see 30% fewer readmissions and they can increase their lifespan by 5 years. So Bob gets in touch with this rehab department to learn a little bit more. So they explain to him that the program consists of 36 sessions during which Bob will exercise and learn more about his condition. He has to drive to the hospital 3 days per week for 12 weeks, spend hours a day there, and he'll end up spending over $1,000 on the program. So this is just too much for him, and he decides not to go. So there are millions of people just like Bob in the US, people who really need cardiac rehab, but they choose not to go because these barriers of cost and inaccessibility are just a little too difficult to overcome. In fact, these barriers are so prevalent that 80% of eligible patients in the US never take part in their recovery program. So patients aren't the only ones who are negatively affected by the inaccessibility of cardiac rehab. So this year, 80% of hospitals will end up receiving a penalty for having excessive readmission rates. So on top of these readmissions already being expensive for the hospitals, they'll be penalized an additional $528 million this year for excessive readmissions. So by declining not to go to his recovery program, Bob's at a much higher chance of contributing to this penalty. So it's really in the hospital's best interest to engage him in this recovery. So to address these problems, we have developed a specialized care management platform that makes cardiac rehab accessible, affordable, manageable, and sustainable. So we provide hospitals with the tools they need to implement a comprehensive home-based cardiac rehab program to eliminate all of these barriers to participation. So we can actually kind of talk about a different story for Bob. So he experiences all these barriers, but before he can say no, his nurses tell him about Phas3. They tell him that he can download an app, and he can use that app to complete the same tasks as a traditional program, and he can do them wherever and whenever he wants. And the hospital will pay for it. So Bob can experience the same benefits as a traditional rehab program, but without all of the barriers. So what does this mean quantitatively? So using our platform, obviously patients can save a lot of time and money by avoiding these transportation issues and co-pays. For providers, increasing patient engagement and reducing readmission rates and improving the quality of care that they provide, pairing that with cost efficiency will lead to a return on investment of up to 10 times. So why is now kind of the right time to be working on this problem? This problem's been around for a long time. We haven't really seen a lot of solutions to it yet. So why is now the right time? Well, first off is that the healthcare industry is transitioning away from fee-for-service more towards a value-based system. So hospitals are getting reimbursed based on the quality of care they provide, so they're sharing in the risk with the insurance providers. Second is, as of this year, a specific CPT code was unbundled, which allows for the reimbursement of remotely generated patient data, or for the review of that data. And this is a big deal because in the past, programs like this were not actually directly reimbursed, so hospitals can now cover the upfront cost of the program. And then also, as of this year, the American Heart Association and the American College of Cardiology actually expanded their definition of cardiac rehabilitation to include home-based programs. So the AHA has finally included in their guidelines that rehab clinics should be looking to increase their reach with more patients by using these kind of novel forms of care delivery. So we have a great team working on this. The founders, myself, Dan, and Sean, have known each other since we started college together about 5 years ago. We're backed by the medical and entrepreneurial expertise of our principal investigators, Dr. Lisa Alderson's assistant professor of cardiology, and Dr. Andy Hall is an assistant professor of biomedical engineering. So we're currently in a sort of validation stage. So we've completed our prototype, which is in use in our first clinical trial. This trial is being funded by the American College of Cardiology, and it's studying kind of compliance of the patients and sort of the feasibility of implementing a system like this. We're actively seeking some more trials and pilots just like this to continue to build our data on the efficacy of this type of program. So one way that we think the community can maybe help us is if anyone knows anyone who works in cardiac rehabilitation or any cardiologists, introduction to those people would be extremely beneficial for us to get their feedback. Another way that we're trying to validate our business is with the business model. So we've been able to develop a viable business model for Medicare patients because CMS makes this data publicly available for us. Private insurance companies typically don't do that, so it's a lot harder to figure out how these private health insurance companies work. So another way that we hope maybe the community can help is providing feedback and kind of expertise on that private insurance or employer health plan area. So on that note, I'd like to thank you for your time, and then if there's kind of just one final thought maybe I could leave you with here, it's to just kind of revisit that problem that we're trying to solve, that 80% of patients with heart disease don't really get the same chance at an extra 5 years of life because of all these barriers. So our mission is to provide them with effective recovery through a convenient alternative. That's kind of what we're working towards every single day. We hope you will join us. Thanks.
Who wants to start? Questions?
Explain to a non-medical person like me, what do you mean by cardiac rehabilitation? Explain that in not going to the hospital and how do you do it at home?
Sure, so cardiac rehabilitation is a recovery program after someone's been diagnosed with heart disease. It's actually really similar to physical therapy, but it's just for patients with heart disease. So you travel to the hospital, you do different activities such as exercising, you learn more about your condition, they teach you how to quit smoking, they help you improve your diet, and you do that 3 days per week for 12 weeks. So these are all activities that we think we can kind of augment and help people do from home as well.
Any opportunity for it to spill over into high blood pressure and type 2 diabetes?
Yeah, those are also very common comorbidities for patients with heart disease and are actually things that the AHA, the American Heart Association, talks about in their guidelines, that those are performance measures for these cardiac rehab programs, so lowering blood pressure and managing blood glucose as well. So they're very interrelated.
Hi, great presentation. So with that component of there being exercise, are there additional hardware like stress testing that the patient would have to purchase in order to do this effectively?
So the patients still have to go to the clinic once to receive their initial treatment plan from their cardiologist, and while they're there they do a stress test and they use an EKG device to do that stress test. And then based on those results, they're able to come up with a target heart rate range for where that patient should be exercising when they're away from the clinic. So part of the product is a heart rate monitor that the patient gets of no charge, which connects to the mobile app, which then tracks their heart rate relative to the target range that they came up with the stress test.
Can you talk a little bit about what the patient use would look like? How does information get into the app, or how do they know what they're doing, and that sort of
actually,
the specifics of what is exactly tracked and how that information gets in there.
Yeah, okay, so it's kind of small, but so nurses, after they identify patients who are a good fit for this type of program, they sign them up through our web dashboard, and they create a custom care plan for the patients, which is like this. So they take those individualized treatment plans, and create tasks for each week for the patient to be accomplishing. And then those patients see on their smartphone app what tasks they were given by their clinician. And they can complete those tasks each week, and all of that data is then sent back to the clinician so they can monitor percent compliance in year 2. And it's kind of worth noting that it's not just like digitizing a care plan. This product's actually been specifically designed to work with each performance measure set out by the AHA for running an effective rehab program.
But can a person just sit on a couch and put information into the app and there's no, like, I'm trying to just...
Where's the accountability?
Yeah, I'm just picturing...
Yeah, so the exercise accountability comes from the heart rate monitor that they wear while they exercise. So if we're tracking how much time they're spending in that target heart rate range. So if they're not doing that, then there's no accountability there. Other things like weight or tobacco habits, those are things that the patient just has to type in themselves. And as far as education, we track how much time the patients spend in the education, and then they take a quiz after. So that's the accountability on if they're consuming that content.
Kind of piggybacking on that, I'm just thinking of, my parents are kind of like, neither of them need this, but are of that age. My dad would never download this app. Not in a million years. I mean, he just wouldn't. How are you going to, how can you incentivize people besides you're going to die of a heart attack in 3 years, which doesn't seem to be enough to people, just because, stereotype here, older people are a little less tech savvy than say your average 20-year-old. And so, is there any way you can incentivize, people to go into something that they're not inherently comfortable with?
That's a really great question, and it's a particularly tough nut to crack in healthcare, which is how do we incentivize people to really truly engage in their own recovery. So it's something that we're actively working on, kind of making the app fun enough to use and kind of teaching people enough about not just like what would happen if they don't do it, but why it's good that they do engage in the recovery. So we've come up with a few things. One example is that all of our patients get discounted memberships to the YMCA. They can get discounted memberships to the botanical gardens. So by participating in our program, we can engage these community resources, kind of work with them. Some of the studies that have happened already show that by providing these programs, you can increase enrollment from 20% to 60%, and you can keep adherence and compliance about the same. Something that no one has been able to do yet is get it past 60%. So really engaging more people is really difficult.
Questions?
And then do you all plan to bundle adherence onto this as well with medication? Or are you strictly keeping it to like the cardiac rehab?
We're working on building medication adherence in right now.
Kind of like Joe, how are you going to get people to use it? Even before, how do you get them to understand that there's a risk involved? For example, millennials think they're going to live forever. And baby boomers, well, I'm ready to go. So how do you get people more involved with it before and after cardiac rehabilitation?
Yeah, preventative care is definitely an area that we want to expand into. It's really difficult to kind of work in that area right now because there's no real quantitative return immediately for the hospitals, so they don't have as much interest in those types of programs, unfortunately. Because it really is an important thing that we need to be working on preventing incidents. But right now our healthcare system is just kind of structured to respond to incidents that have already happened. So that's where we've been focusing so far right now.
There's no money in prevention, there's money in treating.
Yeah, exactly.
Do you have programs for follow-up after, let's say you surmount the barrier of patients entering the program and doing it? Do you have data to follow up? Because that's a treasure trove of cardiac rehab data that a lot of people would want to pay for.
Yeah, so that's what our first clinical trial is currently studying right now, which we're about in the middle of. and we're setting that compliance. People have done similar things before us. The Mayo Clinic has done something like this and shown really good results as far as follow-up adherence. And then several people in Australia and New Zealand have shown pretty good compliance and adherence afterwards. So that's the data that we're currently compiling.
Can you talk a little bit more detail about how you make money?
Yeah, sure. I'm going to turn that over to Dan, actually.
So how we make money for our customers, or how we as a business?
Yeah, how you as a business, like, yeah, who's your customer?
We work with healthcare providers and the hospitals themselves. There's the potential to work with like insurance companies later on. Basically, because our service is reimbursable to the hospitals, they pay us a per patient rate, and then they receive reimbursement after using the product.
I really like this idea. What do you feel your competitive advantage is in creating this app versus somebody coming along, or maybe a hospital itself trying to create some benefits?
One upfront answer I have to that is the cost effectiveness. So we have looked into that because that's a question we've received some pushback on. Generally speaking, it's a lot more expensive for the health systems to sell themselves to develop these types of solutions. And then in terms of the digital health space in general, which there are many companies, we find the context of cardiac rehab is really important. Basically working with this infrastructure that's already in place. We know who our end users will be. It's the cardiac rehab clinics.
Other questions for the team? All right, Jeff.
Do you plan to broaden this beyond cardiac rehab? I mean, where do you see the limits of this app? Because right now, I think you're very smart to be laser focused on one thing, but the long term, where do you see the limits of this? The efficacy of this?
Yeah, that's a really good question. So the next kind of immediate step is with pulmonary rehab. And the reason is because cardiac rehabilitation and pulmonary rehabilitation are very, very similar, just with different kind of conditions and slightly different guidelines. Actually, the the American Association for these programs is for cardiovascular and pulmonary rehab, so it's one thing. So that's kind of the obvious next step. And then past that, kind of any recovery programs where we can create, where it's really important for a provider to be able to create a custom care plan and then track the compliance of that care plan and then feed that data kind of into their own analytics. It can be really important, so we can expand to a lot of other areas as well with that.
Can I follow up question? Sorry.
I had a
Sorry, I know.
question.
No, what's good?
No, I
Good
don't
follow-up
remember.
question. It's relevant here. Okay. Well, my follow-up question is, do you see them eventually going to like physical therapists and selling it directly to them to offer to their clients? Because right now your model is to sell it to insurance companies, which is the right way to go. But could you see expanding this, or would it just be for free to physical therapists just to make it ubiquitous? Because that's a whole other channel, whole ancillary channel that could glom onto this very easily.
Yeah, absolutely. I mean, physical therapy is pretty similar, so it's just kind of that same recovery program structure that's built up. So we could definitely work towards applying this.
And I think that actually kind of links to what I was going to ask too about continued engagement with the user past the required or that specific period of time. My husband had a massive heart attack 4 years ago Friday, and his life is never going to be the same. It's never been the same since that moment, and it went way beyond the cardiac rehab he didn't do. And so just having those regular reminders that are coming through. If he'd had another toy to play with, that probably would have worked well, because he spent a lot of time on an Excel spreadsheet charting all of his vitals on different graphs. So maybe the answer to adoption of things like this is the fact that people are having heart attacks younger, unfortunately.
Yeah,
so you have younger people that are like, give me a tool to get through this. But so just that continued thing. He hasn't had a cigarette since that day, but he thinks about a cigarette every minute. So, having that relationship, I think there's opportunity beyond the required, here's your cardiac rehab weeks.
Yeah, there actually is. That's a really good point, Alyssa, because actually part of why we named the company Phase 3 is because there's 3 phases of cardiac rehab. of which we can actually improve the patient experience for all of them. So phase 1 is kind of when the patient's still in the hospital or just discharged. You need to engage those patients kind of right away and just tell them the importance. Phase 2 is what I talked about with those 36 sessions, really hard to do. Well, after those 36, there's a third phase of cardiac rehab, which is a continual maintenance program. And most places don't really do these phase 3 rehab programs. They kind of just lose touch with their patients. And the patients can't come into the clinic anymore because the insurance won't cover it at that point. So it goes from $20 to $30 copay up to $150 each time they go. So by keeping patients engaged, keep them on this mobile app, the lifetime of those patients, they can maintain that connection for a whole lot longer, throughout, even just past that initial program.
And one other just ancillary story. My dad actually, that he's ignored all this pulmonary rehab, but he said it would have been cool if they'd had something to attach to his phone where he could have practiced blowing that ball up and making it hover. That would have been more fun for him, and he's 72. So, I think that there's customers out there, and if you can figure out how to make a fun thing that where you can blow into it, and so I think, we're only going to get more comfortable with technology as those populations are aging. I hang out with you people all day, and I'm the downhill slide into 50. So, it's.
Your dad and his dad would fight.
Yeah.
Your dad and his dad would fight.
Yeah. Right.
Yeah.
Other questions?
Are you going to the AHA meeting in Chicago? Because that's your make or break meeting. That's the biggest meeting in the world.
I'm sorry, what was that?
The American Heart Association meeting in Chicago. It's November the 10th.
So we are not going to that one this
You need to
November.
go.
You are now.
We are now, though. We are going to the American College of Cardiology one, which is November 3rd. So, but yeah, we're going now.
Right. Mark your calendar. Cool. All right. Okay. Anything else you want to add to what the community can do for you, or restate and remind people? I was bound determined not to forget to ask, because I've been forgetting to ask, and this is my last opportunity. So.
Well, sure. I guess, kind of just remind people. So, if anyone knows people working cardiology or cardiac rehabilitation, we always love that extra feedback, as well as anyone who might have expertise in kind of the private insurance or employer health plan area would be really valuable to us. And then anyone else who, we always just love talking about business in any capacity. So, anyone else who's interested, definitely reach out to us.
Cool.
So,
All right.
yeah, thank you, everyone, for your time.
Yeah. Thank you so much.